recognizes Ms. Kelly for 5 minutes for questions.
Thank you, Chair Guthrie and Ranking Member Eshoo and Secretary Becerra. Good to see you. As you know, I'm a strong supporter of FDA's efforts to prohibit menthol cigarettes and have led numerous letters signed by the majority of CBC colleagues to the administration in support of the rule, and I truly appreciate the leadership of HHS and FDA in sending the menthol rule to the White House for final review. Any idea that you can share of timeline? I know it's been a kind of slow walked. Any ideas, and will you commit to still being on the right side of this rule?
I have to begin first, Congresswoman, by saying we owe you for the work that you've done to try to help get this across the finish line. I think you do it because you know what it means. It means a lot of lives saved, especially in the Black community, because menthol cigarettes impact the lives of more people in the Black community than anywhere else. And so for that, we are indebted to you. And I hope you do, those jets, I hope, still have a lot of fuel in them. I can't give you a particular timeline. It is in the process. You know, when we see the white smoke, we can cheer if we get to see it, but please just don't stop. You continue to do the work you're doing.
I will not stop. Quickly, my grandparents owned a mom and pop grocery store in New York, and now when I think back how many people was in Harlem asked for Kohl's or Salem or Newports. So,
that was intentional on the part of the industry.
I know. I also want to commend the administration for its commitment to safeguarding and enhancing access to comprehensive range of reproductive health services nationwide. The allocation of $376 million to address disparities in maternal mortality and morbidity is a crucial investment in saving the lives of Black and indigenous moms and birthing parents who are so unduly burdened with negative birth outcomes. But what concerns me, I hear from so many providers and groups, especially those in minority populations or those in rural areas, that they are unable to access the funding streams from the administration. A notable illustration of this issue is evident in last year's KFF report, which revealed that no Black rural areas have received any rural maternity and obstetrics management strategies funding until concerns were raised by me and others. So how will the administration work to ensure that funding, reaches the areas that really, really need it most at the end of the day, and not just the bigger organizations, but really the community organizations also?
And Congresswoman, I was recently in both Mississippi and Alabama, and we spoke, and I met with a group of healthcare leaders, mostly from the Black community, about this, but on a number of issues, but this obviously came up as well. What I can tell you is that we're trying to reach all those communities because the purpose of, in fact, the president's budget calls for more than $370 million to address this maternal mortality and morbidity issue. We wanted to reach the right communities. So if there's something that we're not doing that you think we should, please let us know. We are reaching out. As I said, I traveled to states where this is a big issue. We're going to do everything we can, but we could use some help.
Okay. And I just, we are putting on a Black Maternal Health Forum right now, and I just left Congresswoman Sewell. So I think, meeting with us, would help. And she just talked about it in her area. But thank you. My last question, CMS has proposed a rule that will make sweeping changes to how Medicaid drug rebates will be calculated. Several provider and patient groups have reached out expressing concern regarding the potential unintended consequences this rule could have on patient care and access. Given that this proposal is still under consideration, would your office be willing to follow up with me regarding the concerns?
Absolutely, we'll follow up with you, and I can guarantee you we're not going to do something that's going to impact patient care.
Appreciate that. Yeah. Thank you so much, and keep up the great work. Thank you.
Gentlelady yields back. Chair recognizes Dr. Bashan for 5 minutes for questions.